This video aimed to provide helpful information as you or your child embark on the journey to recover from appendicitis. Appendicitis is one of the most common pediatric surgical conditions that we take care of in KK Women's and Children's Hospital. It is the inflammation or infection of the appendix, a small organ that connects to a part of the large intestine. The inflammation occurs when the opening of the appendix is blocked, and bacteria starts to grow. During the process of inflammation, the appendix will become swollen or even burst in some cases. To diagnose appendicitis, usually, a few things are done. Firstly, your child's surgeon will ask you some questions to gather information that will help them understand your child's symptoms better. Following that, the surgeon will check your child's tummy. Depending on your child's symptoms and how your child's tummy looks like, a blood test is usually conducted for further evaluation if there is suspicion of appendicitis. Ultrasound scans are often done to evaluate the size and condition of the appendix. You can be assured that the ultrasound scan would not hurt and does not expose your child to any radiation. In rare cases when overall clinical impression is not noticeably clear after the above steps, a repeated blood test or further imaging such as CT scan may need to be performed. Appendicitis has been commonly treated with surgical removal of the appendix, also known as appendicectomy. But recently, research has shown that some appendicitis can also be treated with antibiotics only. Your child's surgeon will advise you on the most appropriate option. Based on past research, treating appendicitis with antibiotics works for 90% of cases, which means that your child can avoid undergoing surgery. However, if the appendix is not removed, there is a chance for appendicitis to occur again. Studies have shown that there is a 20% chance of reoccurrence within the first year, and a 40% chance of reoccurrence within 5 years. As for the other 10%, surgery is necessary, especially if child have worsening abdominal pain or fever. Appendicectomy can be done as a keyhole surgery under general anesthesia. Your child will be put to sleep with a breathing tube to help them breathe during the surgery. Once your child is put to sleep, your child's surgeon will make 2 to 3 small incisions to insert a camera and instruments to remove the inflamed appendix. Occasionally, for safety, the surgeon may have to make a bigger incision. The surgery will take approximately 1 to 2 hours or even longer depending on what was encountered in the abdomen. After the surgery, your child's surgical team will update you on what was found in your child's tummy. Appendix C may be normal, inflamed or perforated. Other unexpected conditions may also be encountered. No matter the condition, our medical team will explain the treatment options to you. After the surgery, your child will be sent to the ward for monitoring of vital signs, oxygen level and pain. You may see your child with monitoring devices such as the urine tube, nose-to-stomach tube or a surgical drain into the tummy. Please ask your doctors or nurses about these devices if you have any questions. The initial phase of monitoring will be more frequent, but this will be reduced as your child recovers. Duration of stay in the hospital will be determined by your child's condition. Generally, a longer stay in the hospital will be expected if your child has perforated appendix. This is because your child will take longer to recover and need antibiotics administered through the veins. In general, your child will be able to go home once they are able to walk comfortably with manageable pain and eat soft food without vomiting. Problems after surgery do not happen very often. But potential problems that we will look out for after surgery includes persistent fever, ileus whereby intestines stop moving and pus collects in the abdomen cavity. Now that your child is deemed fit for home, their normal diet can resume. However, your child should take pain medicine regularly for the next 1 to 2 days as pain is anticipated. Strenuous activity should also be avoided for the next 2 weeks. Most of our stitches are self-absorbable and do not require removal. You may remove the dressings at home 1 week after the surgery. Your doctor will explain all these to you before discharge. Please do not hesitate to ask your doctor if you are unsure or have further questions. Watch out for symptoms such as persistent abdominal pain, abdominal distension, and vomiting. Seek medical attention immediately if these symptoms occur. Should your child require any medical attention for post-surgical care after appendicectomy, during office hours, you may proceed to the Children's Surgery Center at Women's Tower, Basement 1. After office hours, please proceed to Children's Emergency. Please consult your doctor if you require more information. Thank you and wishing you or your child a speedy recovery.